This study of about 500,000 medical records really dug into the link between severe viral infections and neurodegenerative diseases like Alzheimer's, Parkinson's, and even ALS, showing some pretty striking associations.
Right. It seems like the researchers found 22 connections overall. And get this, those with viral encephalitis were 31 times more likely to develop Alzheimer's. Quite remarkable, wouldn't you say?
Absolutely. It's like, the viruses are not just passing through. Many of them are neurotrophic, meaning they can cross the blood-brain barrier and
Yeah.
potentially set the stage for long-term issues in the brain.
And I mean, they even found that the impact of these viral infections could linger for up to 15 years. That's quite a long time, and it really makes you think about how infections might kickstart a cascade of, detrimental neurological effects.
Right, exactly. It's like, you catch a severe infection, say pneumonia, or even flu-induced complications, and months or years later, you see a spike in risk for conditions like dementia, Parkinson's, and Alzheimer's. It really underscores a potential avoidable factor.
Yeah, and it's particularly interesting because they pointed out that for many of these viruses, vaccines are already available. So it begs the question, could more robust vaccination actually mitigate long-term neurodegenerative risks?
Exactly. It's like, think about it. If you're getting vaccinated against, say, influenza or shingles, you're not only dodging immediate illness, but maybe also lowering your risk of these nasty brain disorders. It's an added
Right.
bonus that we need to consider.
True, although I do wonder, isn't it a bit of a stretch to connect vaccines so directly with lowering Alzheimer's risk? There might be other confounding factors at play, right?
That's a fair point. The study is observational, so it can't prove causality, but it does add weight to the idea that viral infections might be a modifiable risk factor. It's a call for more detailed research, I'd say, not a clincher yet.
Exactly. It's an intriguing correlation that invites us to rethink our public health strategies. And the data science approach they used, combing through such massive records, really gives us a broad view of these associations.
Yeah, and it's refreshing to see a method that moves beyond looking at one virus at a time. Aggregating data from 35,000 Finns up to 100,000 from the UK Biobank is, pretty groundbreaking in scope. It paves the way to a more systematic understanding.
And for a field where treatment options are so limited, even a modest reduction in risk via vaccination might have huge implications. It's not just about individual health, but the broader public health perspective.
Absolutely. The idea that infections and inflammation could be, largely avoidable factors in neurodegeneration gives us a real opportunity to shift prevention strategies. Although I get your point about needing cautious interpretation, it's promising, but still
Right.
preliminary.
Exactly. It's a solid reminder of the complex interplay between infections and long-term neurological health, and how crucial it is to keep exploring every angle, even ones that seem indirect at first.
For sure, it's a fascinating study that opens up so many avenues for future research and might just reframe how we think about preventing these challenging diseases. It's an exciting time in neurogenetics and public health.